Hello everyone. Now we are continuing our history taking course. Now we will be talking about the peripheral neurons or two chief complaints, tremor and muscle weakness. So as I mentioned earlier is that the most important thing is that we know the differential diagnosis for each chief complaint and we ask questions about each differentials. So for tremor, what do we have with differentials? Could be physiological, could be cerebellar disease, it could be Parkinsonism, it could be essential tremor, could be liver disease, could be drugs, or it could be hyperthyroidism. So first off, like when someone presents to you with a tremor, you ask him how long it's been going on for. Did you try anything that helped? Any previous episodes? How did it start? Any family history of that situation, medical conditions, any medications, okay? And social history, do you take any drugs, okay? Any surgeries in the past? And then we jump to the differentials. Physiologic tremor, you tell them, like, the tremor, is it associated with any event? For example, if someone wanna give a presentation to a large audience, okay? This could trigger tremor. It could be anxiety, something like that. Cerebellar disease is different due to cerebellum. So cerebellum is the one. So cerebellum is such a wonderful mechanism. Is that control? There's the flexor and the extensors muscles. They both control my hand to be in this position. That controlled by the cerebellum. If the cerebellum, if anything happen to the cerebellum, there will be imbalance between flexor and extensor, and that what causes a tremor. So we told him any abnormal eye movement, because cerebellum usually have eye movement, nystagmus, it's called. Or have you noticed any problem with movement, okay, or complex movement? Usually they have difficulty with balance. Parkinson disease, another differentials is that we ask, have you noticed any slow movement? Okay, this is important symptom of Parkinson. Have you noticed any stiffness in your body? Because the Parkinson is the basal ganglia, is the one that controls our movement with the cerebellum too. So the base, any stiffness of the body, okay. Basal ganglia also control the flexor and extensor. Have you noticed any change in your writing? They call it, they have changing in writing, and they call it pill rolling tremors like that. Parkinson. Essential tremor, usually there's a family history for that, okay? And it's relieved by alcohol or propranolol. Why? Because propranolol inhibit the beta 2 receptor, and this is the Golgi apparatus, the one that controls the flexor and extensor in the muscles. So this will decrease the tremor. Alcohol is the same, suppresses the neurons and inhibit the tremor of essential tremor. So this is one of the features of essential tremors. And the cerebellar tremor also, it's a resting tremor. Like while you're resting, you have it. Okay. Well, essential tremor is a movement tremor. Like when you move, when you try to move, it's worsen. Physiological, same. Like when with movement, it will get worse. For liver disease, you ask, have you noticed any distension of your belly? Okay. This is important. Any enlargement of the breast, gynecomastia. You'll have liver failure. If you notice any change in the color of your skin, because it causes jaundice if your liver is not working well. For drugs, we ask are you taking any caffeine, any nicotine, TCA, lithium, any medication that tremor can be caused by medications like valproic acid, lithium, TCA, beta agonist, nicotine, caffeine. Hyperthyroidism is very important differential. So we ask about any racing of your heart. Have you noticed any skin changes? This is with hyperthyroidism and liver disorder. Okay. And this tremor is the main chief complaint that presented. Okay, so this is with the tremor. Like in a quick summary: physiological, cerebellar, Parkinson, essential tremor, liver disease, drugs, hyperthyroidism. Now we'll talk about another chief complaint. It's called muscle weakness. Okay, this is an important one though. So the first question after we ask, well, how long has it been going on? When did it start? Anything make it better? Anything worse? Is it all the time? Is it intermittent? Medical history, family history, okay, social history. After we take care of all of those, okay, you can check out video number 1. It's more explained in details. We ask about stiffness. So stiffness. So there are, if there's a stiffness, they have different differentials, and if there's no stiffness, they have a different differentials too. Okay. So let's say the patient says that they have a stiffness. So stiffness, it could be fibromyalgia, it could be polymyalgia rheumatica, it could be a trauma, muscle strain could cause stiffness, it could be myotonic dystrophy, family history, it could be a stroke, or it could be Parkinsonism, or it could be multiple sclerosis, can cause stiffness, or drugs. Okay, so let's see how we ask about each one of them. So for fibromyalgia, they have you ask them any tender points in your body, okay? And then the tender they have, this is most important. So the fibromyalgia has a lot of symptoms, for example, anxiety, depression, dizziness, sleep disorder, fatigue, weight gain, pain. But the most specific question, because we don't have a lot of time with the patients, so the most specific to fibromyalgia is the one that they have tender points in their body, trigger points. Polymyalgia rheumatica usually affect the proximal muscles of the shoulders and the lower extremities, proximal lower extremities. So we ask them, have you noticed any difficulty on standing from sitting position? Because these big muscle groups are the ones that help us stand from a sitting position. Another specific question, notice any changes in your vision or headache. Why? Because polymyalgia rheumatica associated with temporal arthritis that causes changes in vision and causes headache. Then we ask, have you noticed any problem while chewing? This is another symptom of temporal arthritis, which is a very dangerous diagnosis, could cause blindness. So that's why we give them a steroid immediately if we suspect it. And it's associated with polymyalgia rheumatica that causes muscle weakness. For muscle strain, it's easy. Have you had any trauma? Have you lifted any heavy weight recently? That's another. Myotonic dystrophy, it breaks my heart. It's such an unfortunate diagnosis. Like it's run through the family. It's family history, so it's not their fault. It's just they happen to have it. So we ask him, and have you noticed any hair loss from your head? Okay, so associated with that. Have you noticed any difficulty with releasing your grip? This is a very specific question to myotonic dystrophies, that when they hold the grip to open the door, it's very hard to open their hand again and release and let go of the door. So that's another one. Another thing, stroke. Stroke. So we ask them any problem with swallowing because it causes dysphagia, difficult to swallow. And then we ask the common symptoms, weakness in your arms or sudden weakness, numbness, tingling, trouble walking, another thing too. And any vision changes too can happen with stroke. So this is a fast acronym for stroke, is that face dropping, arm weakness, speech difficulty, and then T, just time to call 1911. Okay, so Parkinson disease. You see they have a lot of symptoms. Mask-like faces, Parkinson gait, slow movement, rigidity, freezing, shuffling steps, postural instability. But the ones that we don't have time to ask about all of them, so let's ask about 3 specific questions. So have you noticed any slow movement? Okay, any stiffness in your body? They already said that there's stiffness, that's why we're in this differentials. And have you noticed any changes in your writing too? It's rolling tremor, so they have difficulty writing too. Okay, Another one, multiple sclerosis. Multiple sclerosis picture is usually young female. It's relapsing and remitting symptoms. So it's neurological symptoms that are separated by time and place. So for example, one time they have eye symptoms, and after a few months they have arm symptoms, weakness in their arm, and then after a couple of months they have weakness in their legs. It's like that. So have you noticed any change in your vision? Another one, because it causes optic neuritis. This is common presentation. Okay, basically multiple sclerosis, an unfortunate situations, usually same thing like with autoimmune disease, damages the Schwann cell and causes these problems. Another thing for drugs, so do you take any drugs? We asked about the antidopamine, the one that used for uh, psychosis, can causes tremor, can causes muscle weakness, stiffness, antipsychotics. Okay, so this if the patient said with the stiffness. So again, the differentials: fibromyalgia, polymyalgia rheumatica, muscle strain, trauma, myotonic dystrophy, gait and vision abnormalities, Parkinson, multiple sclerosis, and drugs. Okay. Now, what if they said they don't have stiffness, they just have muscle weakness? Now the differentials will be different. For example, let's see. It could be hyperthyroidism. High thyroid damages the muscles. It could be polymyositis. Okay. It could be dermatomyositis. And it could be Guillain-Barré syndrome, which is an autoimmune disease that damages the peripheral nervous system. Multiple sclerosis is the one that damages the central nervous system. It could be myasthenia gravis, and the drugs too can cause that. And electrolyte hypokalemia, because potassium is one very important electrolyte that control muscle contraction. So let's come to hyperthyroidism. We discussed about it in the previous lectures that we asked them 3 specific questions because we don't have time to ask about all the symptoms. So we ask any racing of your heart. Have you noticed any changes in your skin? Any tremor of your hand? Okay. Another thing, polymyositis, we ask them any difficulty combing head or standing from sitting position to. Why? Because polymyositis, it causes difficulty in the proximal muscles. It's similar to polymyalgia rheumatica, but polymyalgia rheumatica causes stiffness, but this one doesn't. So proximal muscles of the lower and upper extremities, like this shoulder and here. So for dermatomyositis, you tell them any rash in your body. So in your brain, what are you asking about? Asking about Guthrie papules and heliotrope rash. For Guillain-Barré syndrome, we ask him, do you have any history of diarrhea? Because usually have diarrhea by Campylobacter jejuni or any other bugs that causes that triggers the immune system to damage the peripheral nervous system. So you have muscle weakness. It's a very unfortunate situation too. It's very sad. One time I saw a patient, he's been in the hospital for 20 years just because of the Guillain-Barré syndrome. He had a severe case. So it's a tough situation. And how did the weakness progress too? This is important one. Like how did it, because it's ascending paralysis. It's lower extremity and then the upper extremity. For myasthenia gravis, it's very unfortunate too. Basically, antibody that attacking the nicotinic receptor. So we ask them, do you have any problem in swallowing? Have you noticed any problem in vision or double vision? Because it's usually happen in the bulbar area, like swallowing vision. And it's very hard. I had one time I had a friend who had it. He had problem reading the questions while taking his exams because the eye shut down, so he can't sit for more than 40 hours. So there are so many things that we are so blessed to have them, but we don't think about them. Like, so let's just take a moment and be grateful for what we have. Regardless how bad your life is going on right now, just remember that you can open your eyes and close it. There are people who can't. Okay, trust me. These are the myasthenia gravis people. Drugs, for example, steroids, statin, could damages the muscles and causes just weakness without stiffness too. So it's a simple question: do you take any medications? And just open-ended, and they will tell you. For electrolyte hypokalemia. So hypokalemia is any history of diarrhea. Usually with diarrhea, you lose a lot of electrolyte. That's why people drink a lot of water, or if it's severe dehydration, they give them electrolyte, IV fluid. It's like that. Okay. So after we ask about all these differentials and like fibromyalgia, polymyalgia rheumatica, trauma, myotonic dystrophy, stroke, Parkinsonism, multiple sclerosis, hyperthyroidism, polymyositis, dermatomyositis, Guillain-Barré syndrome, myasthenia gravis, etc. Then we go to physical exam. Physical exam, we do head, ear, eye, ear, nose, throat exam, central nervous system, and we do extremity examination too. Then we do lab work. We do CBC and CMP. This is with everyone almost. TSH, we check for the T3, T4 for the thyroid. Nerve conduction study for Guillain-Barré syndrome. MRI of the brain for multiple sclerosis. Okay, they have oligoclonal band or some, or if there's a brain tumor or whatever that can damages the central, the motor area of the brain, could cause weakness too. ANA, this is MRI like it's in advance, we don't start with it, but this is just to keep it in mind. ANA anti-neutrophilic antibody, because autoimmune diseases associated with autoimmune disease. Anti-Ro, anti-La, these are one of the antibodies that damages the muscles, so we check for them too. Okay, so this is for muscle weakness. For so we talked about tremor, muscle weakness. Tremor, I think we did not talk about the exam. We do hint exam, thyroid, central nervous system, and we do Romberg test, close your eyes and like this. And labs, CBC differential, TSH, T3, T4, and we do CMP. CMP give us IST, ALT, and bilirubin too. So here's the tremor. We talked about tremor and we talked about muscle weakness. I hope you guys liked this video, and if you have any feedback, please let me know in the comment. Thank you so much for your time and your listening.